Anatomical terms which are used to describe regions and planes of the body and the location of a specific body part. A. Esophagus, stomach, intestine. B. Body position, anatomical plane, and directional term. The answer is B. Body position, anatomical plane, and directional term. A person standing upright with the head facing forward, the upper limbs held by the side of the body with the palms facing forward and the feet brought close together facing forward. A. Anatomical position. B. Anatomical terms. The answer is A. Anatomical position. The anatomical position refers to the position of the body. There are two positions used to describe body landmarks. A. Supine position and prone position. B. Left and right. The answer is A. Supine position and prone position. Blank are planes that pass through the body and are used as the basis of anatomical description in the anatomical position. A. Prone position. B. Anatomical plane. C. Supine position. The answer is B. Anatomical plane. In order to look at the internal structure of the body. Blank refers to the vertical plane passes longitudinally through the midline. A. Paramedian plane. B. Coronal plane. C. Median plane. The answer is C. Median plane. The median plane does divide the body into equal right and left halves. Blank refers to the plane which passes vertically through the body to divide it into an equal left and right position. A. Paramedian plane. B. Transverse plane. C. Frontal plane. The answer is Paramedian plane. It is parallel to the midsagittal plane. Blank refers to the plane which passes horizontally through the body, that is, at right angle to the longitudinal axis of the body and divide the body into upper and lower part. A. Midsagittal plane. B. Transverse plane. The answer is B. Transverse plane. Transverse or cross sections refers to a cut made at a right angle of the long axis of the organ. Blank are used in comparison of relationship of anatomical structure. These include medial versus anterior versus and etc. A. Anatomical plane. B. Directional term. The answer is B. Directional terms. The heart is medial to the lungs whilst the lungs are lateral to the heart. A. Medial versus lateral. B. Ventral versus. C. Superior versus. The answer is A. Medial versus lateral. Medial is used to describe the position of the structures which is nearer to the median plane, while lateral refers to a structure which is away from the median plane. Blank is used to describe the position of structures which lies nearer to the front of the body. A. Superior versus inferior. B. Anterior versus posterior. The answer is B. Anterior versus posterior. The sternum is anterior to the heart whilst the heart is posterior to the sternum. Structures located near the head are referred to as superior, while structures located away from the head or closer to the feet are described as inferior. A. Superficial versus deep. B. Superior versus inferior. C. Palm versus plantar. The answer is B. Superior versus inferior. The term superficial describes structures which are located towards the body surface, while the term deep refers to structures found farther from the surface. A. Superficial versus deep. B. Ipsilateral versus contralateral. The answer is A. Superficial versus deep. Is used to denote structures of the same side and structures located the opposite side of the body. A. Proximal versus distal. B. Ipsilateral versus contralateral. The answer is B. Ipsilateral versus contralateral. The right arm is ipsilateral to the right leg. The right arm is contralateral to the left leg. The term blank is used to describe the touch end of a limb. Example is the bone of the upper limb. A. Palmar versus plantar. B. Proximal versus distal. C. Interior versus exterior. The answer is proximal versus distal. The humerus is proximal. The tibia is distal to the femur. The part of skin that touch when a joint bends, and the part of the skin on the opposite side of the joint. A. Interior versus exterior. B. Palmar versus plantar. C. Flexor versus extensor surface. The answer is C. Flexor versus extensor surface. The palm of the hand and the sole of the foot called A. Palmar versus plantar. B. Medial versus lateral. The answer is A. Palmar versus lateral. The term blank is used to describe the inner aspect of hollow organ, while the term blank is used to describe the outer surface of hollow organ. A. Superficial versus deep. B. Interior versus exterior. The answer is interior versus exterior. The term blank refers to inward protrusions, while blank refers to outward protrusion. A. Volar versus plantar. B. Plantar versus flexor. C. Invagination versus evagination. The answer is C. Invagination versus evagination.